Hyperosmolar hyperglycemic state. Hyperosmolar hyperglycemic state, HHS, is a medical emergency characterized by severe hyperglycemia, hyperosmolarity, and dehydration without significant ketoacidosis. It primarily affects patients with type 2 diabetes. Diagnostic criteria. All of the following are typically present: hypovolemia, marked hyperglycemia over 30 millimoles per litre, serum osmolality over 320 milliosmoles per kilo calculated as 2 times sodium plus glucose plus urea. No significant hyperketonemia less than 3 millimoles per litre, and no significant acidosis, bicarbonate over 15 millimoles per litre or pH over 7.3. Pathophysiology. In type 2 diabetes, insulin is present but insufficient to control blood glucose effectively. This leads to persistent marked hyperglycemia over 30 millimoles per litre, osmotic diuresis causing large water and electrolyte losses, severe volume depletion leading to serum hyperosmolarity over 320 milliosmoles per kilo and increased blood viscosity. Hyperosmolarity causes water to shift from intracellular to extracellular compartments, including from brain cells, leading to neurological symptoms. Risk factors: intercurrent illness or infection, inadequate diabetes management or missed medication, dementia or cognitive impairment, and sedative or antipsychotic medication use. Symptoms: clinical features of dehydration, polyuria and polydipsia, lethargy or fatigue, blurred vision, nausea and vomiting, altered consciousness or confusion, focal neurological deficits, and non-specific abdominal discomfort. Signs: marked hyperglycemia, often over 33 millimoles per litre, dry skin, reduced skin turgor, and dry mucous membranes, tachycardia, hypotension, elevated serum osmolality over 320 milliosmoles per kilo, absence of significant ketosis or acidosis, altered mental status, neurological signs due to cerebral dehydration, for example, seizures and hemiparesis, and laboratory findings: raised sodium from dehydration, elevated urea and creatinine from prerenal AKI. Diagnosis: blood tests, blood glucose over 30 millimoles per litre, serum osmolality over 320 milliosmoles per kilo, normal or mildly elevated ketones, electrolyte panel to detect imbalances. Arterial or venous blood gas typically shows a normal pH, differentiating it from diabetic ketoacidosis. Identify precipitating cause, for example, infection screen, medication review, or ECG. Complications: thromboembolic events due to dehydration and hyperviscosity. Give prophylactic low molecular weight heparin unless contraindicated. Electrolyte imbalances, particularly potassium disturbance. acute kidney injury, and neurological complications, seizures, coma, and death. Management. The main priorities are fluid replacement. Start with IV 0.9% sodium chloride at 0.5 to 1 liters per hour. Patients may appear less dehydrated due to preserved intravascular volume from hypertonicity. Adjust fluid rate based on cardiovascular status, urine output, and comorbidities. Monitor sodium closely. Correction of hyperglycemia can increase serum sodium. Insulin therapy. Fluids alone should lower the glucose. Only start insulin if the glucose is not falling by at least 5 millimoles per liter per hour with fluids alone. Reduce or stop insulin if glucose falls too rapidly to avoid cerebral edema. Electrolyte monitoring and replacement. Potassium. Hypokalemia is common, especially after insulin initiation. If potassium is less than 3.3 millimoles per liter, replace before starting insulin. Maintain a potassium between 4 to 5 millimoles per liter. Sodium. This may rise with treatment. Monitor regularly. Phosphate and magnesium. Monitor and replace if low. Treat the underlying cause. Commonly infection, mismedication, or medication induced, for example, steroids and antipsychotics. Prevention. Patient education on diabetes self-management. Emphasize hydration and glucose monitoring during illness. And sick day rules. That was the full video, and there's hundreds more like it waiting for you at finalmed.co.uk. Get over 9,000 UKMLA exam questions, hundreds of animated videos, and our trusted textbook all in one platform designed to make your revision faster, clearer, and exam focused. Start your free 7-day trial today